Hello, my name is Ekomobong Inyang, and I researched the Black Death. How many of you know what the Black Death is? I'll be discussing a basic introduction of the Black Death, its causes and transmission, symptoms, history, treatment, its demographics, the experiment that I chose to research, and a little nursery rhyme decoding. Black Death is a zoonotic disease, which means it is transmitted through animals. It is highly lethal, and within 2 to 7 days of infection, victims will die. It also killed 60% of Europe's population during the 14th century. It is caused by the Yersinia pestis disease, which is transmitted through the bite of a flea, tick, or infected rat. It is also transmitted through through air droplets, infected air droplets, and contact with an infected person. There are 3 types of plague. The bubonic plague, which is infection of the muscle tissue, the septicemic plague, which is infection of blood, and the pneumonic plague, which is the infection of the lungs. Now, who here knows the nursery rhyme, Ring Around the Rosie? And who does not? Well, if you don't, here's a reminder. The old nursery rhyme is actually the equivalent of the symptoms and treatments of the Black Death of the 14th century. Ring around the rosy, pocket full of posies, ashes, ashes, we all fall down. Ring around the rosy is supposed to describe the tick bite, which actually creates a rash and dark circles and buboes wherever the tick bite was. Pocket full of posies. Posy is a medicinal herb or flower that they use to treat the Black Death back in the 14th century, since they didn't have actual research tools to know what exactly worked. Ashes, ashes is supposed to describe the symptoms of the Black Death, which include coughing, hacking, wheezing, vomiting, gangrene, and compulsive sneezing. And then we all fall down is that victims are almost 100% guaranteed to die within 2 to 7 days of getting the disease. It has close to 100% fatality rate. The symptoms of the Black Death include nausea, headache, swollen lymph nodes, dark dying muscle tissue, internal bleeding, hemoptysis, which is coughing up blood, wheezing, shortness of breath, vomiting of blood, gangrene, fever, chills, abdominal pain, fatigue, giant boils covering skin, bullseye rash, almost, kind of like Lyme disease, but not exactly, and compulsive sneezing. This disease actually originated in Asia, contrary to popular belief, and it killed 20 million Asians while developing there. Roman travelers via the Silk Road carried the disease from Asia down to Europe, and throughout the Silk Road it also traveled down to Egypt, which was part of northern Africa and Central Africa. It arrived in Sicily, Italy in 1347, and it killed 60% of Europe's population throughout the time. There were several outbreaks throughout the medieval times, and doctors used herb treatments because they did not have actual research to know what would work. And since at the time Rome was an oligarchy, meaning that only kings and nobles were able to afford and have rights to most things. So the peasants and other lower classes would go to people called barber surgeons, which would actually use treatments that hasten the death, and they use different treatments such as bloodletting, which is cutting open the dark buboes, which were often filled with water, pus, and blood. There are different types of treatments for the Black Death or the bubonic plague. There is gentamicin, which is an aminoglycoside. It can be given orally or via injection. It kills gram-negative bacteria. And what gram-negative or gram-positive bacteria is, it's a specific stain color on the bacteria when tested on. Red Red bacteria color is gram-negative, and then purple is gram-positive. And it is also used as a penicillin replacement for those who are allergic. It stays active in high temperatures and remains active after sterilizing as well. But on the other hand, it poisons bone marrow, it corrupts the blood cells, it is a neurotoxin, which means it kills brain cells as well, and it causes gray baby syndrome, which basically slightly poisons the baby inside of the uterus of a pregnant woman and discolors their skin and teeth. Chloramphenicol, which is effective against gram-negative and gram-positive bacteria. It is inexpensive, and that is why third and second world countries turn to this antibiotic, because it is inexpensive and readily available. It is effective against anaerobic bacteria and is also used as a penicillin replacement for those who are allergic to it. Except it poisons bone marrow. It is an idiosyncratic aplastic anemia, which means it also kills blood cells as well. It is a neurotoxic, it causes neurotoxic reactions, which means it also kills brain cells as well, and causes gray baby syndrome. Streptomycin is an effective pesticide and fungicide, and is effective against Yersinia pestis. It is a protein inhibitor so that the bacterium inside of you will not continue to grow and kill off muscle tissue. It is on the World Health Organization's list of essential medicines, and it can be given intravenous, which is injected directly into your veins, or intramuscular, which is directly into your muscle tissue. Except it causes fever, rashes, nephrotoxicity, which is attacking of the kidneys, ototoxicity, which is basically an ear infection, and frameshift mutation. Who here knows what the frameshift mutation is? Who here does not remember what the frameshift mutation is? The frameshift mutation is when parts of the DNA or genetic information is either deleted or added into places where it's not supposed to be. And the last one is tetracycline. It cures exotic diseases such as anthrax and brucellosis. It is also on the World Health Organization's list of essential medicines, and it manages infections and is also another protein inhibitor. Except it causes skin sensitivity and is inactivated by dairy and multivitamins. And it causes anaphylactic shock, which is basically severe allergies. The experiment I chose to do was an experiment of different parts of Hawaii. Some people were infected with the plague, and they recorded the number of recoveries and deaths of it. As stated by the pie chart, in Oahu, there were 204 people that died, which was 89% of it, and then 11% recovered out of the 228. In Kauai, there was all 11 people died from the bubonic plague. In Maui, there was one person who recovered, which was the 6%, and then there were 15 people that died, which was 94% of the data. In Hawaii, there was 10 people that recovered, which was 6%, and 146 people died, which was 94% of the data. In Hilo, there was 34 people that died, and then nine people that recovered from the disease, which was 21%. In Hamakua, there was one person that recovered, which was 1%, and then 111 others died from the disease, which was 99% out of the 112. The total data, there was 410 people that were infected with the disease. Only 35 recovered, which is 9% of the data. Then 91% of the data, and people, which was 375 people, they all died from the bubonic plague. In conclusion, the bubonic plague the plague in general is a highly lethal and contagious disease, and is often compared to the newest outbreak of Ebola, actually. Thank you for your time. This concludes my presentation. Questions? to air. Anaerobic bacteria is bacteria that do not need air to survive. Yeah, oxygen. Oh, Ms. Boswell.
When did this experiment in Hawaii take place?
The experiment itself did not specify, but the journal article was released in 2006.